But this chart really shows on the left side who is not included, who doesn't have any changes as a result of Kentucky Health, and on the right side, who is included in Kentucky Health. So on the left side, we have our traditional Medicaid groups, those who are on Medicaid because of their age, because they may be blind or they may have a disability. And that includes our 1915C waiver groups, including home and community-based waivers, our Model Waiver 2, supports for community living, the Michelle P. waiver, the acquired brain injury and long-term care acquired brain injury groups. They have absolutely no changes. There's nothing that's changing for these individuals or groups. And that also includes our nursing facility and long-term care residents and qualified Medicare beneficiaries. So that group on the left side will experience nothing new when July 1st rolls around. The groups on the right side, though, and each of these groups, they're divided up into 4 different categories. They each will have slightly different versions of Medicaid benefits when Kentucky Health changes July 1st. For example, our traditional Medicaid adults who were eligible before expansion happened, they will continue to have their same benefits. They will have either a premium payment or a copay. It's not both. No change in benefits, and they'll continue to get their vision and dental through their managed care organization. And they may have a community engagement requirement unless they are a primary caregiver of a dependent child. So that's our traditional Medicaid adults who are eligible before expansion. For pregnant women and children, and these are our traditional Medicaid and K-CHIP members, they have no changes. They will have no premiums, no change in benefits, and there will not be a community engagement requirement for pregnant women and children. Medically frail adults and former foster youth to age 26 on the bottom right, these groups of individuals will have optional premiums. They'll have the option to pay a premium to get access to the My Rewards account. They will not have a change in benefits, so they'll still get their vision and dental through their MCO, and they do not have a community engagement requirement. I would like to point out, though, that even if someone does not have a community engagement requirement, we are making resources at our career centers and through our adult ed programs available to anybody who wants to access them. So there may not be a requirement, but these resources will be open to anyone who'd like to go to those facilities and those resources. The Medicaid expansion adult group, this is the group that will see the most significant number of changes to their Medicaid benefits. We have 485,000 individuals currently as part of our expansion group who are known to us, who we have access to, who we have interactions with, and this is an opportunity for us to continue to incentivize preventive behavior. So the Medicaid expansion adults represent that group. They will have either a premium payment or a copayment. They have a plan that's very similar to the state employee benefit plan. So they have their health insurance through one avenue, and that is through Kentucky Health. And then their vision and dental, routine vision and dental benefits will be through what's called the My Rewards account, and it is a health spending-like account. And then there is a community engagement requirement for these individuals unless they're a primary caregiver or have another exemption.